Good morning, everyone. My name is Carrie Craig, and I will be your host this morning. It is a pleasure to have you participate on the last of our COVID-19 webinars, Returning to Work. Before I turn over the webinar to Prosperity Indiana's Executive Director, I would like to mention a few housekeeping items. Please be aware that all audio is muted. If you'd like to ask a question, please type it in the Q&A box. You'll find your screen. All know that now can try to get special working from home. So if you lose your connection, you may also reconnect in the link email to you. And finally, you can access today's presentation and recording on Prosperity Indiana's COVID-19 Resources Hub at the website address noted here. Now I wish to turn over to Prosperity for some opening remarks. Jessica?
Hi, Carrie. Thank you. Your sound was a little rough, so I wanted to make sure you can hear me okay.
Yes, I can.
Okay. So good morning, everyone. Thank you for joining us. I hope you're having a great start to your week. Today's webinar will really help us to focus on the future in a positive way, even while forcing ourselves to think through the possible challenges facing us as we return to the office. I know for me, the new norm has my 5-year-old returning today to his old routine of going to preschool, although his routine now involves face masks. And as I'm still working from the air quote comforts of home, and I say it that way because while I'm ready to get out of the house in many ways, I also know it's not the simplest of things to do these days. And while my son's child care has been operating and tweaking their processes really since the end of March when they went back to work, our own office will soon be entering this brave new world in a slow, methodical, staggered, and largely voluntary way in the next few weeks. So I'll be taking notes right alongside the rest of you. For now, our team is starting the 15th full week of working from home, and I continue to be amazed by the resilience. Although a small team, we've seen team members experience loss that had to be grieved over Zoom. We've seen team members ride the wave of unemployment in their immediate family. We've seen team members manage working from home with kids. We've seen team members balance schoolwork while continuing to do their work, and so much more. And so we are not unchanged by this pandemic, and I'm so thankful for this group. My gratefulness also extends to Fifth Third Bank for supporting our work through our strengthening our communities grant to provide training and technical assistance to nonprofits, especially those working in affordable housing. And you'll see, if you've noticed our coming lineup of trainings, that while we'll continue to address the ways that COVID-19 and racial equity impact our work and the work of our members, issues that really are top of mind at the moment, we will also be pivoting starting in July back to a more narrowly focused community development capacity building array of webinars. And so we thank Fifth Third once again for supporting our webinars through this COVID-19 immediate relief phase, and now as we're moving further into recovery and resiliency. And in doing that, I would now like to welcome once again Jadira Hoptree with Fifth Third Bank. Jadira is Vice President and Community Economic Development Manager for Fifth Third Bank Indiana, overseeing the charitable giving process and Fifth Third Foundation grants, as well as lending and economic development programs for underserved communities in the state. And so thank you and good morning, Jadira.
Good morning, Jessica. Good morning, Carrie. Let me do a audio check first. Can you hear me okay?
Yes, we can.
Okay, great. Well, thank you, Jessica. Thank you, Prosperity Indiana, once again for offering and for continue pivoting these webinars to what we continue to hear from our partners that is important to them. I wanted to thank all the participants because I keep seeing your names and the names of your organization, so the resiliency and you making a priority to continue to serve your community, it's really very inspiring to me. And thank you today to the presenters for caring, for your empathy, for doing the research and sharing very, very important knowledge for us to move in a positive way through this time in the state of Indiana. As well as you said, Jessica, this is a topic today that encompass all of us. Me, for example, as I mentioned, I was out of town. I have to go and take care of my mom that was sick, and take care of her last week. So as I come back, I needed to be tested, and I have to quarantine myself, although the test was negative. But I wanted to quarantine myself for 2 more weeks in my house, very isolated, just to make sure that if for any reason the test was negative, I don't get anybody in danger. And my teams are receiving a lot of requests for in-person meetings, but we are trying to let everybody know that it's our responsibility to keep this isolation a little longer. So Indiana continues to be one of those states that are not increasing on the pandemic and the virus. So that is also very important for the economic development of this state. As for Fifth Third, we continue. We continue our commitment to support inclusive and economic mobility, either in an isolation and finding ways, initiatives to serve you. I was very excited and proud, to be honest, that Fifth Third not only decided to observe Juneteenth this past Friday, but our executive leadership, as well as us, our local leadership, used the day to reflect and discuss our responsibility for inclusion, diversity, and equality in the state. We are also participating in a statewide discussion. So if any of your counties is having discussions, feel free to let me know about those. Also, on a fun fact, Saturday, we participated in the virtual Indy Pride Parade. And it was a great way to see how virtually the Indy Pride continued to serve the LGBT community with important information and as well a lot of fun. I learned a lot through it. I'm sorry, it was Sunday when we participated. To close, I wanted to let you know and remind you that I'm looking for opportunities to partner with you, the non-for-profit organizations, in virtual financial empowerment webinars. Especially right now in the northern, western, and southern Indiana, I am looking for at least one presentation. I am learning through the presentations that we have already housed that I learned so much, and my team learned so much about the community and its needs, and it helped me to pivot and identify the areas that we want to support financially as well. The virtual financial empowerment webinars that we are offering are in the topics of preparing for homeownership, is homeownership for me, budgeting, credit management, and workforce development. Many of the sessions offer opportunities to continue with one-on-one counseling and scholarships for other services. All these services are offered for free. Again, the ones that we have already offered have been very enlightening and very, very engaging. However, if you are also already offering this type of webinars for your community, I also want to offer you volunteers. My team wants to really learn, either by offering our own virtual webinars or to join in yours. There is great ways to serve the community this way. So feel free to contact me via my email, which is my first name dot my last name at 53.com, or my phone number 317-383-2494. Thank you again. Have a wonderful week, and I look forward to learn more through this webinar. Back to you, Carrie.
Thank you, Jadira, and thank you to our partners again at Fifth Third Bank for making today's webinar possible. And I'd like now to take a moment to just briefly share with you a little bit about Prosperity Indiana for those of you who may not know us. For 30 years, Indiana has mobilized hundreds of members and thousands of people to economic opportunities and improve social conditions, particularly for those disadvantaged. Prosperity Indiana is a statewide intermediary organization with a local focus. Our member organizations strengthen communities and improve lives in rural, suburban, and urban areas in all of Indiana's 92 counties. Members provide housing opportunity, they meet basic needs, they connect Hoosiers to jobs, they create vital places, they do all of this and more. Is to build a future for community, leveraging resources and engaging an empowered network of members to create inclusive opportunities that build assets and improve lives. We do this source such as training, direct technical assistance, and financial supports to organizations, people, and neighborhoods. Through our engagement, we're bringing people together to learn and support one another. And through our advocacy, we advocate for policies that support our member work and keep members informed of policy at the state and federal levels. And then we also have a number of signature programs which are customized for the benefit of our members. And I'd like to introduce our first speaker for today, Jeremy York, who is an HR specialist with Synergy. Since 1989, Synergy has been a trusted advisor to its clients, providing a full spectrum of professional, employer, and human capital management services. So now I'd like to turn it over to Jeremy for his presentation. Jeremy?
Thank you, Carrie, and thank you for this opportunity to be here with all of you today. I think many of you, we've all been in this together of experiencing a new normal. Something that's different for us, right? So it's been quite challenging on a lot of ends. So today, what I want to talk about is the look forward of returning to work and what that might be like for most of us and what we should be thinking about and how we should prepare ourselves. I think we can probably break this down into 3 different sections as we look about returning to work. And one of them is planning the return, preparing the office, and of course, we've got to prepare our people. For what that might look like when we come back to work and what we should be focused on and what people are going to need as we look through all of that. So part of that is planning that initial return back to work. For some of you, maybe you've already done this. You started integrating back into a more normalized routine or schedule with the folks that you're working with in the office, or maybe it's a combination of working at home and working in the office. But the first thing that you really should look at and focus on is creating a return to work strategy and planning it out, right? We have to be very thoughtful about the things that we do as it relates to bringing everyone back into a workplace setting and it being something related to COVID-19, right? I know a lot of people are looking at this as if we have moved past kind of the initial pandemic, but we know that it's still a part of our lives. People are still testing positive. As Jadir said, yes, we're lucky to be in a state where that seems to be a little bit more on the decline with the infection rate. And, Indiana's done a great job with being able to help keep us informed and maintain that. But we know we're still not in the clear yet. So we have to be very thoughtful at planning that return to work strategy. And maybe even looking at, okay, maybe it's a team we need to put together to help us be able to orchestrate and focus on what we need to do as we come back to work. So a lot of times when we look at putting a team together, we need to make sure that we've got the right players, people who can really think about what we need to do from a business operations standpoint, what we need to do from a people management standpoint, and what we need to do from meeting the needs of our customers, right? So make sure that you've got the right people involved, the right players to be able to help you create that strategy initially. You also have to make sure that you have flexible return to work plans. So you're going to have to, as I say, you can't just have a plan and say, okay, this is it, it's black and white. Well, the world doesn't work that way, right? And we understand that. So we have to make sure that we do have some flexibility within our plans and what that's going to look like. Every company's return to work plan will be unique. It'll be different. And it may be, have to be altered based on what your business is, your location, local requirements. We've seen that a lot through this pandemic where localities have different requirements. I know here in Marion County, we weren't necessarily following the same protocols as the rest of the state. So you've got to make sure as you look at your excuse me, your return to work plans that you take those local considerations into play in your plan. You also have to look at the number of employees that will be working in one location, how many people will be in the office, does it make sense to return everyone at the same time, or what have you. So that's why I also say that, while you're flexible, you might want to consider looking at a more phased approach into bringing people back, and asking the questions like, okay, who's essential, who needs to come back first, when, and who do we bring back. We really want to rely on some neutral factors in determining who comes back first. As we have to think about every employment situation and employment decision, we want to make sure that we're basing it on business needs. What makes sense for the business in bringing people back? Now, there's not necessarily a rush to bring everyone back unless the business requires it. So we really, again, need to be thoughtful in identifying what we do, when we do it, who comes back, how they're all situated within the office, and really thinking through that whole process, right? So those employees who are the most essential, those maybe are the ones where you want to start bringing them back first. After that, you'll want to look at other criteria, perhaps that may help you decide, some things such as like skills or knowledge or experience that maybe will help you determine who comes back next. You'll want to make sure that you develop a detailed and neutral decision-making process in deciding, which employees you're going to bring back and who's going to be on the first wave of the return, who will be the second wave, or some of those kinds of things. It's important to remember that we still are fighting this pandemic. It's still out there. People are still getting sick. So we want to be, again, very cautious in the way that we return people back to work and working in a remote environment, or working in an office environment versus a remote environment. So we'll want to pay close attention to that. As part of your plan, you also want to make sure that you're monitoring and evaluating the effectiveness of the plan, right? So we've got this big question in our head. What if phase 2 of COVID sweeps about, right? What if we have to face that again? Well, we've got to make sure that we have a plan in place to address that. What does that look like? We've been through this once. We kind of got a feel for what the situation is like, but if we have to deal with it again, what steps are we prepared, and I'm underlining that word, prepared, to take to address phase 2, right? So we probably need to have a plan in place for into our current strategy of being able to monitor our plans, and if we have exposure to a phase 2, what does that look like for us from work, and be able to be prepared to address that and handle it. We also want to pay attention to, hey, what if employees are afraid to come back from work? What if employees ask us, hey, we want to continue to work from home even more so because we're still afraid, we're still dealing with all of this? So as part of that, you've got to ask yourself, what are our answers as an organization to those questions? How do we respond to people, right? If these folks have been working from home already and they've been successful at doing so, why can't we continue to do that? And should we? So when we think about the world at work and what we've dealt with this year and what we're going to be looking at for moving forward, we know that it's radically changed, and maybe not just for right now, it might be changed forever in some ways. So a lot of employers, for example, are already examining whether or not office space really was once a given for everyone to have is really even needed, given our ability to be able to work from home and people still be successful in being able to collaborate virtually, right? And many employers will face the additional request that people say, hey, can I just work from home full time? Is that an option for me now? I've proven over the last 3 months that I can do it. Can I continue to do it? So, and you've got to be able to answer those questions accurately, consistently, with a lot of thought, thinking about what really works. And ultimately, it depends on the business need and what the business wants. And for some employers, it may make sense that, hey, I can allow a person to work from home 3 days a week. They've got to come in the office 2 days, or whatever that may look like. But you've got to be prepared to answer that question, because I'm sure employees will ask that. Hey, I've been successful working from home. Why can't I do this full time? We also have to understand about those people who are maybe still afraid to come back to work. How do we address that? Are we okay with them still, working from home, social distancing, and not returning to work at this point in time? Again, what does the business need? But what also makes sense for that employee? We want to also illustrate and demonstrate that we value their health and wellness and we care about them. But what really makes sense on our side? If it's just for another month or two and they're asking to be able to work remotely because they're concerned about coming back to work, can we do that? Does it make sense? For that person? Are they in a category where they're more exposed? Are they over a certain age? Or they have other health issues that might make them a little bit more susceptible to COVID-19? And those are conversations that we'll have to have. Or what if it's someone who says, you know what, I have caregiver responsibilities and I can't return to work because I've got to take care of either my children, or for an elderly parent, or someone who's immune compromised, or any of those kinds of things. So we'll want to be prepared to be able to address that as well as those requests come in as we look at returning to work and what employees might be asking us as part of that plan. Now, one thing I want to just kind of touch on for a moment, because we did just talk about caregiving and watching out for employees who may have that responsibility, is that we'll want to also ensure that we're well versed in the CARES Act, and that we're well versed in the Family First Coronavirus Response Act, the FFCRA. Those are the things that provide employees, especially employers who have less than 50 employees, caregiving leave and paid caregiving leave up to a certain point in time. So you want to make sure that you're well versed on that. If you're not, for those of you who do have some HR representation, be able to work with that person to answer the questions about that particular leave and that act, and what the pay is, the qualifications for paying underneath FFCRA and the CARES Act. That was put in place to kind of help people continue to carry on, given that our worlds have been turned upside down by something we've not had to experience before. It was fast legislation. We all had to learn it very quickly, and at some point we're still kind of navigating through what it all means. But I want to pay special attention to that so people understand and know that that is out there, something we need to pay attention to for employees at that point. A few more tips about your return to work plan and some of the worksite considerations to think about. And I think number one that should be on all of our minds is safety first, right? So, the health and safety of our people should be our top priority. And we want to make sure that we're bringing people back into the office into a way that try to be as normal as possible. But as Jessica said, with her 5-year-old today going back to preschool, kind of in a normal sense, but now that new normal is wearing a mask. And we want to create in the workplace a sense of normalcy as much as possible, but we also have to put in the right precautions to ensure that we're protecting people from the pandemic, and how do we continue to safeguard employees' well-being so that no one does get sick or exposed while at work. Employees are really counting on us as their employers to help them get back to work safely. And for folks that are in management roles at organizations, they'll really have to understand and ensure that compliance with federal, state, and local orders and restrictions and CDC guidelines is paramount and is key to ensuring that employees feel safe when they come back to work. So we'll definitely need to understand what's expected from our local governments and agencies, and make sure that we're putting some of those things into place, updating any kind of safety procedures or safety manuals, and understand what that looks like for all of us. once we're getting to that point to be able to reopen, we know that we still will probably face new challenges, but we need to be prepared for what those may be. And we understand that we don't know what they might be. So we just have to really be prepared and know. And we do that by understanding what's currently expected of us, how the virus doesn't spread, and how it does spread, and what we need to do from our employees. So those new protocols and policies may be needed for employees, even vendors, and even customers who you might be working with or dealing with. That also means that we'll have to make sure that we update any policies and procedures to ensure any changes due to the pandemic to help us restore, the right kinds of productivity and what that might look like. So we may have new policies on, such as PTO carryover. That's a big thing that a lot of people are talking about. Folks weren't able to take vacations for most of the first half of the year because they were working from home, and it was just, the world just kind of shut down a little bit. So what do we do for that? When we look at our safety procedures and the requirements of PPE at work, we may have to have new policies that say, hey, when you're in a meeting or you're interacting with other people, you have to have a face mask and you have to keep 6 feet distance. And you may have to do that in break rooms or in cafeterias or lunch spaces or any kinds of those things where you may have to update those policies. Now, that might necessarily not mean that it is a long-term policy change, but maybe it is a temporary policy change given what we're dealing with. So we have to access, our policies and assess them and determine what policies do we need to alter, and are these a long-term alterations or are they short-term alterations given what we're dealing with. We also have to make sure that we're looking at, are we doing things that actually make sense for us to protect our employees and help us do the business? I've seen a lot of employers talk about, well, our employees can't wear masks for this because of X, Y, Z. Well, we may have to change other things on how we do something without it really just being too disruptive, in order to ensure the safety for our folks is number one and priority and key. Again, employees want to know that we, or the employer, are doing all that we can to ensure their safekeeping, to ensure that we're looking out for them and we've got their best interests in mind. So what I want to move to next is kind of talking about how we prepare the office. We've talked about putting a plan together, all the things that we should be thinking about, considerations, but what about the actual changes in preparation to the office? What does that look like for you? Well, one of those things when we look at reopening guidelines is really to ensure that social distancing plans are in place and that they're well communicated to employees, right? And anyone else, for vendors or visitors or any of those kinds of people who might be coming to your office. Or maybe you're going to limit visitors or any of those things. So you've got to understand, as part of that social distancing plan, what are the expectations and who are impacted. Because you want to also ensure that these plans will help protect employees and reassure them, as we said earlier, that they're safe, and help those people who also fear the return to work. Got to ensure those plans reduce, one, your liability, which is important, right? And also to protect employees who come into the workplace. So what that means overall is that you're going to have to make some physical workspace modifications, and you're going to have to really limit in-person interactions and physical contact in the workplace so that people understand and what that feels like. I know in a lot of small offices, we think of our coworkers as kind of like our family, and we trust them, and we let our guards down and we get really, really relaxed. And what we really need to pay attention to is, like, we don't know what goes on in these other people's homes, or who they're hanging out with, who they're interacting with, those things. So we have to continue to have that in our minds. So we've got to limit that that space, limit those interactions and that physical contact. We've also got to train all of our employees as well as managers on social distancing protocols and policies. We have to be diligent. All of us have to be diligent in making sure we're taking the right precautions. Yes, we may not want to wear a mask, or yes, we may think that we can still get close with a mask on, but we need to respect other people who might not feel that way, and ensure as an organization we've outlined what that looks like. We may also have to implement screening protocols. And I know that for the state of Indiana, for anyone who is returning back to work, the governor had made it a requirement that folks had some type of screening protocols put into place. And so that means that you may want to have a questionnaire that asks people, have you been out of the country in the last 14 days? Have you been exposed knowingly to anyone that may have had COVID-19? Have you had a fever in the last 2 weeks? Do you have any of the symptoms? Such as fatigue, fever, cough, any of these kinds of things. And some employers are even taking employees' temperatures before they start the workday. And those screening procedures, here's the thing, that has to be done every day before employees come into work, right? So every day there has to be that screening procedure needs to be implemented or practiced every day for folks to come in if you're going to do something like that and have those protocols in place. You also will want to consider providing PPE, personal protective equipment, providing them the masks, providing them with hand sanitizer, providing them with gloves if they request that, making sure they've got the right kinds of resources to be able to do the work, ensuring that desks are far enough apart. We live in a world a lot of times where it's cubicle heaven is what I like to call it, right? Where cubes are close together and people are packed in for space. That may not work anymore because it doesn't allow us to provide the 6 foot of distance that we need to be able to keep people safe. So those are just some considerations as we look at the workspace and what that might be like. But I also want to say that, and I don't want to say I want to caution you, but I want it to be top of mind, really, as you're talking about these transitions and what the workspace can look like. Number one is you've got to be patient and flexible, right? It's like we're dealing with things we've never had to deal with before. We don't have all the answers. We don't know. So we've got to just kind of say, hey, let's figure this out together. Let's collaborate. But the key is being clear in your communications, being open and honest, and ensure that employees feel comfortable having a dialogue with you as well, where they can feel like they can express their concerns and you can express your concerns or everyone's concerns as part of that. And that's something that is probably one of the most important components of returning back to work safely and what that might be for everyone overall, right? So that's a big part of it. You want to also make sure that everyone has a certain set of expectations of what it is for them to be at work, when they're supposed to arrive, what they should be doing when they're there, encouraging them to wash their hands, wear their PPE, holding people accountable when they're not wearing their PPE. And this is something that I always share with everyone, is that wearing PPE appropriately, right? Wearing the mask over your nose and your mouth. I can't tell you how many times I see people wearing their masks below their nose, and that is not effective. That does not help anyone. And I know they're uncomfortable to work in, but when we come into a workspace, we need to help employees understand that it's not all about them. It's about everyone, and it's about protecting everyone. And so therefore, we want people to wear the PPE appropriately for their own protection, but as well as for the protection of other people, right? And we need to help people understand that, because I feel like we do live in a world where we promote individuality. You can do what you want, you can be what you want, etc. But we also need to help promote at work that it's an environment where we're trying to have everyone be safe, and that we've got to look out not just for ourselves, but we have to look out for other people, in addition to other people and their families, right? We have to remember that when we are exposed to something at work, we take that home to our families, the possibility of that happening. And so we're trying to protect a lot of people by requiring, people to wear face masks, etc. The last of the third component here is really preparing the people. So preparing your employees for coming back to work. And as I said earlier about making sure that you communicate effectively, part of preparing them is creating that clear and concise communication plan where you're providing clarification on what this new normal might look like. Maybe even having FAQs on how to deal with some of the challenges that they may face in the office and what things might look like for them. You want to include proactive steps that you're taking as an employer to ensure employee safety and also ensure that safety is key and that you're really concerned about employees being safe when they return to work. I can't express enough how much transparency is key with this. You know, we all know that a lack of openness and honesty leads to more fear, and it leads to more rumors, and it leads to more gossip. So when we're clear about what we know, and we're also clear about what we don't know, and what we're trying to learn more about, it helps people have more faith in us. It helps people feel better to say, hey, we don't know this, but we're looking into this, or we do know this, and here's what we're doing. And we also want to ensure that as we communicate, that we empower employees to notify us about any kind of changing conditions or situations that they're dealing with at work. So we want to make sure they understand that. We also want to help employees combat any kind of burnout that they may have, right? So for those of you who have an employee assistance program as part of your benefits package or an EAP, it's a great way to be able to reintroduce that to your people so that they can contact the EAP. You may want to update any of your benefit or highlight any of your benefit information that is related to maybe telehealth if you have that, or any kind of virtual wellness memberships or any of those things. I know as we partner with Prosperity Indiana as being their professional employer organization, part of our benefits does have telehealth programs, which I know has been great during this time, to where you can see your physician or contact a physician either by video consults or by phone. So those are kind of things that we want to highlight to people and help them to ensure they feel safe when they return to work. We also want to ensure that we communicate at the same time that we still have work to get done when people come to work, right? We know that they've been doing it remotely, and maybe we've, allowed them to, and I'm doing air quotes here, slack off a little bit, just giving them a little bit of extra room to maybe not perform as well or be as productive because of what we're dealing with, right? With their maybe their spouse having to work at home along with them, their children working at home. Our world has been turned upside down. But when we come back into work, we need to ease them back into productivity, but also let them know that we still expect them to perform at the level they're performing before all of this. So we want to make sure that we address any of those performance issues immediately as we come back. Don't wait for that, and ensure that we're providing them with regular feedback. They're going to need more feedback again as we ease them back into the workplace and what's expected of them. You also want to try to get them back to a sense of normalcy. And so that might mean that you need to provide some team collaboration opportunities with social distancing in play. Yes, I want to make sure I get that in, but try to return them back to work as much as possible. Recognize small wins that are going on within the office. Ensure that you're celebrating things that you celebrated before. Just try to create that sense of normalcy for employees. And that's really something that we've got to work extra hard at as we bring them back into the office. So hopefully, as I wrap up on these return to work components, that it's made some sense about, making sure that we've got a plan, making sure that we ensure safety and preparing the workplace, and also preparing the employee for coming back to work and what that might look like for them. It's been hard for us. It's been hard for everyone, this new normal. It's made us look at things and see things way differently than we ever thought that we could or would. And I think really overall, it's making us really rethink work and the work situation and what that might entail for us. I think the workforce forever has been changed, and we're going to continue to see the aftermath or the effects of COVID-19 on the way that we work for the next couple of years in the way we shape workforce policy, workforce procedures, health and safety issues, as well as ways of working and the way that we've introduced technology in collaborating and what that looks like for us. So again, we've just got to be ready and be flexible, and we've got to be prepared for that. So Carrie, I'm going to turn it back over to you for the next part here, but I'm happy to answer questions as we have them.
Thank you so much, Jeremy, for being our presenter today. Does anyone have any questions for Jeremy right off? If you do, you can raise your hand on the screen, or you can also type your questions in the question and answer box. So there was a lot of great information there that Jeremy shared with us, and wanted to see if folks had specific questions before we move on. Yeah, we have one here, Jeremy, from Alyssa Winters, who says, does Jeremy have any policies available? Are there any policies out there, Jeremy, that you know of that are that folks can download or utilize?
There are a lot of policies that have been out there on the internet that have been developed. People have been rushing and struggling to, try to create some of these policies, et cetera. So for folks that are, I don't know if anyone's familiar with the Society for Human Resource Management, or SHRM, but you can go to their website, to shrm.org, and that's shrm.org, and they have a whole section of employer resources as it relates to COVID-19. Now, for a lot of folks, for some of these resources, you do have to be a member of SHRM to access it, but for a lot of the other resources, they're just free and they're out there for you to be able to utilize. They've also got great resources as it relates to COVID-19, but also a lot of new resources as it relates to the social change that's happening within our workplaces right now with the Black Lives Matter movement, LGBTQ plus employees, recognizing, and just diversity initiatives all together. So that would be a great resource I would recommend, where you could get some of these policies.
Great, thank you, Jeremy. Any further questions before we move on? Okay, well, let's move on now. I want to just introduce to you Hoosier Uplands. We're going to bring them in for the organizational perspective on returning to work. Hoosier Uplands is a local nonprofit agency based in Southern Indiana that serves as an area agency on aging, a community action agency, a licensed home health care and hospice agency, and a community housing development organization. Its mission is to plan, implement, or cause to be implemented and provide comprehensive services to the poor, elderly, and disabled. They strive to alleviate poverty, improve living conditions, and provide access to healthcare and social services to those families and individuals in need within their 5-county service area. And so I'm going to just have a conversation with Alyssa Prince, who is their Chief Strategy Officer. Good morning, Alyssa.
Good morning, Carrie. Thank you for having me.
Well, thank you for joining us. In light of what Jeremy shared, can you share some of Hoosier Uplands' return to work strategies?
Yes, of course. So our agency, as you could hear from Carrie's introduction, is we have a lot of different programs. So our return to work has kind of varied depending on program. And we created a plan for our return to work based on each department maybe needing their own specific plan for return. So some of the basic things that we're doing, which are a lot of the things that Jeremy mentioned in his conversation, things like asking our clients to wear masks whenever we start meeting with clients, which we have just started doing recently, and we are still trying to meet just over the phone for programs that will still allow us to do that. We are asking our staff to also wear masks if they're directly with clients, asking staff to wear masks if they're in close contact with any other staff within the office. We are not requiring them just because, you know, everybody has different reasons why a mask may or may not be the best for them. So we want to leave that option up to them. But if they are going to be close to somebody, we do ask that they wear one. Some other things that we're continuing to do is not allowing any visitors into the office. You know, any of our outside delivery people, a lot of the times they would just walk back into the office and deliver products. We're not allowing that at the time. No work travel still. We're also doing like a 3-phase approach for bringing people back and how we will start traveling and allowing different departments to bring more staff back in. So in our first phase, which most of us started about a week ago, we started bringing our capacity back to around 50% per department. For some departments, they did this a little bit differently, but mine in particular, there's no reason to rush it. Most of my staff don't have as much to do in the summertime because their primary work is in the school systems. So there's just not really a need to force it right now and bring a whole bunch of people back in for no reason. Also, my staff are all in cubicles, so we are in closer contact. We are outside of the 6 feet distance, but still a little bit closer than I would prefer. So we are actually phasing people back in until the end of July.
Great. Sounds like that you've done a number of things. One of the questions I had for you, Melissa, is how did COVID-19 change the way your organization interacted with its program clients?
So that has really varied based on program. One that I feel like has had a very significant change and a change for the good is we actually have a mental health clinic where we have a psychiatrist on staff and approximately 10 therapists. And prior to COVID-19, we had never done telemedicine before. At the beginning of this, we got everything all set up, and for a little while, that's what we were doing 100%, which I think is an excellent service for us to be able to offer. Our therapists have said that there's a variety of mental health diagnoses that have really reacted well to the telemedicine, and a lot of them, they said, like with ADHD clients, it has been huge because a lot of them would just forget about their appointment, but it wasn't that they didn't want to have their appointment. So whenever a doctor just called them, then they were able to just go ahead and do their appointment. It was no big deal and they weren't missing out. So I think that has been one huge thing that has been a major success and an entirely different way of interacting with clients. A lot of our other programs, like WIC and our Baby and Me Tobacco Free program and our aging services, all of our contracts have allowed us to do those appointments by phone right now, which has been super helpful. A lot of our clients have really appreciated that. And for a lot of the services, you know, they're still getting what they would have gotten even if they were coming in person. With WIC, it's a little bit different because we do need to see the babies every now and then to make sure they are gaining weight the way they should, that they're growing the way they should, and that sort of thing. And also just a nice face check-in with the moms to see how they're doing. But it still has been a great opportunity to help the people that did often miss their appointments. We're not having that now.
Great. Jeremy mentioned towards the end that work is going to change somewhat dramatically moving forward. Do you anticipate that kind of the kinds of changes that's going to happen as a result of COVID-19 will force Hoosier Uplands to perhaps plan differently as a result of COVID-19 moving forward? You know, what will you do, or do you plan to do anything differently than you did before?
I think one of the big things that COVID-19 has changed for us is our use of technology. You know, our agency, not to say that we didn't use technology before, because of course we did, but not to the extent that we do now. Whenever all of this started happening, we made sure that all directors got a logged in account so that they could access their computers from home. That is something that none of us had before, which I think is a huge help. That way, if one of us are sick or we do have to be off for some reason, but somebody needs something for us, we can easily access that. And that's something that, you know, there just wasn't a real need for before, or at least we didn't think there was. Also, like in my department, we use Google Docs for just about everything, which I didn't realize how awesome that was until all of this happened, because it was really easy for even those that didn't have a LogMeIn account, they still had access to all of their stuff super easy while they were at home. And also being able to share all of our documents without seeing each other and doing that easily and in a streamlined process was super helpful. Also, like our aging department, they didn't have laptops before. And that was something that there had been talk about before, but they just hadn't done it yet. And I think that'll be something that will help them whenever they're going out and doing appointments with clients in person in the future. They'll have laptops that they can do their notes right then and there if they want to. And then again, with our mental health services, I think that will be huge. You know, the technology for that was very expensive to get everything set up. And now that we have it, it's going to be something that we're going to be able to continue going forward with, even once we do start seeing clients in person regularly again.
As the Chief Strategy Officer at Hoosier Uplands, how has COVID-19 impacted the strategic direction of the organization? Or has it?
I think that it has. I think the technology piece is one big part of that. Really just considering the new ways we can use technology to make us the most successful. Something we had already been working on, which I know most of you probably already have this, but we didn't, was like some sort of time card system that we can do electronically. Currently, we're still doing handwritten time cards. And of course, during all of this, we realized how challenging that was. Luckily, that had already been something that was in progress and something that we're working on getting. So, you know, a change like that, any of our technology changes, I think are going to be huge for us in the future and are only going to help us to grow and help our overall mission. And something else too that I think that this time has really shown us now more than ever is you know, having our close community partnerships has really helped us to know what the needs are right now. As a community action agency, that is one of the most important things that we do is listen to our community and know what we need to do. But I think that that has really set us up for a strategic direction in that whenever something comes along, we just figure out what is needed and we go forward and try to help with that. One in particular thing that happened during the very beginning of the pandemic was we realized that there was a huge need for PPE in our communities. We had a huge outbreak at one of our local healthcare facilities, and the staff there were using gowns over and over again, using masks over and over again, and working directly with COVID-19 patients, but they were doing the best they could with what they had. By learning that information, we were able to help with that and actually purchased a ton of PPE for all of the health departments and healthcare professionals and first responders in all of our service area. And without our close partnerships, I don't know that we would have been aware of that huge need at the time. So yeah.
Great. Well, thank you for sharing the perspective of a local organization, Alyssa. I appreciate it. While we have just a few more minutes, I'd like to open it up for any questions that folks have for either Alyssa or Jeremy. Again, you can raise your hand by using the raised hand icon on the GoToWebinar feature, or you can type your question in the question and answer chat box. You don't have a question, but you may have a comment or best practice that you'd like to share with your colleagues. You may do that as well. So feel free to raise your hand or type your question in the Q&A box.
Carrie, this is Jessica. Can I ask a question?
Sure.
I'm curious, and this could be for Jeremy or Alyssa, and forgive me if I missed it, but thoughts on daily screenings and what that looks like. Jeremy may have seen that look different at different employers, so that would be an interesting thing to hear about.
Sure, I can take that, Jessica. So what a lot of organizations are doing are it's kind of twofold. One is that they've developed a questionnaire to be able to ask people every day before they go into the office, right, and begin work. And part of that is, asking about exposure. If they've been out of the country in the last 14 days, have they had these symptoms within the last 14 days? And they might list the symptoms off, such as like a fever, chills, loss of taste, loss of smell, any of these other kinds of things that are typically associated with COVID. And if the employee responds yes to those, they don't allow that person to come into work. That person has to go back home and they quarantine for 14 days or something of that nature. So they're doing that. Alongside of it, the second component is that some employers are actually taking temperatures as part of that and not allowing people to come in to work if they're running a temperature. And there's a range for that, what they'll allow people to come in, because, everyone's temperature fluctuates. Some people are, running their normal temperatures 99, right? And some people, it just fluctuates. So it's like, at what point do you allow someone to come in or you don't come in? So there's some guides and resources with all that if you are taking temperature screenings as part of folks being able to come into the office. But what I've seen mostly is that it's usually just a questionnaire that people are answering, and they have to do that every day when they come into the office, or before. Some employers don't even let them come in the door until they've answered those questions.
Jeremy, this is Carrie. I have a follow-up question to that. Are there any health privacy rules or regulations that we need to be aware of when obtaining this type of information?
It's a great question, Carrie. So one thing that I didn't mention before that I should have mentioned is that these questionnaires are documented. You've got to make sure that you document your screening every day for each person, et cetera. As far as what, any kind of personal health information or anything like that, asking these particular questions aren't necessarily a violation of HIPAA or any of these other components, because we're not asking specifically about diagnosis or conditions. But sometimes employees may share that voluntarily. So there is a fine line there. And a lot of questions that employers have had is, who should be the person taking this, answering these questionnaires or taking this information or having access to this information? And, the answer is that if you don't have someone that's an HR person, it should be HR. If you don't have an HR person, it needs to be someone who's probably a member of management or has a high likelihood of working with confidential information and knowing what that means. That is in charge of that. So there could be some potential exposure there, but as far as just asking questions on the screening sheet or anything like that, most guidance has been it's not necessarily a violation or concern unless the employee starts to go into their personal health history.
Very good, thank you. Just a final call out here for any further questions or comments before we close out. Well, I'm seeing none. I just want to thank everyone for their participation. If you've been participating in this series during these last few months, we really appreciate it. I'd just like to point out, what Jessica said early on in her remarks, that we are pivoting to a different series of webinars and moving away from COVID-19. You can find those webinars on our website at www.prosperityindiana.org. And so look for those under events, and the registration panels are up and ready to take your registrations. So we hope that you will come back in the future and participate in more of our webinars. Again, thank you everyone for joining us today. Have a wonderful week. Take care.